Okay, that means the Newton questions are asking on the basis of some criteria which are set by the NCSBN. That NCSBN is the Board of Nursing which are conducting this NCLEX examination. So while doing question, each questions are mainly focusing on the based on some criteria. Okay, sometimes if the question is about to identify the complication like that, that will come under the risk reduction. Okay, and some what questions which are promoting the safety of the drug, and that means the drug related questions mainly coming under the pharmacological and parental therapy. Okay, and some questions like the ICD, ostomy care, ICD care, the nutrition, that will come under the basic comfort, basic care and comfort. So like that, I will detailedly tell you about what are the main criteria and what are the areas of questions which are mainly focusing each criteria. Okay, so we
Okay.
can start that. First, I will introduce about what are the main criterias. Okay, the main criterias are, the first one is the physiological integrity. Okay, in the physiological integrity, uh, two no three topics are coming. First one is the basic care and comfort. That means the foundations of nursing. Okay, second one, the pharmacology, pharmacological and parental therapies. Third one, reduction of risk potential. That is the to identify the early signs of the complications and what are the management like that. And next one, physiological adaptation. Physiological adaptation means what are the physiological changes. For example, when a microorganism enters into our body, there may be some changes in our physiology or the hemodynamics. So, what are the changes are occurring? Or suppose if any of the systems are affecting, for example, respiratory system, GA system, that peripheral vascular system, reproductive system. So, in each that topic, that means the topic which are coming under each system, and what are the changes happening in, for example, if it is a respiratory system, when a patient is having any disease conditions related to the respiratory condition, the mainly changes will affect in which organ. If it is a
Uh, uh, Lungs.
lungs, like that. And if it is a GI system, mouth to anus is
Uh,
the GI system part. So if any of the organ is affecting, which will affect the GI system. So the client will shows the symptoms of GI system related. Okay, and if the client is having an issue with the urinary system, it will affect the urine production. Mainly how we can identify, we can monitor the urine output, we can check the vital signs, especially blood pressure. Okay, and if it is a cardiovascular system, it will mainly affect our heart. Okay, and how we can identify the basic uh,
Heart.
parameters from the vital signs, from the blood pressure, from the pulse, and also the oxygen saturation. Okay, like that we have to identify which system is affected and what are the changes. We know that each system has some common symptoms, and common symptoms for particular diseases, and some specific symptoms are there for but specific diseases. For example, COPD and pneumonia, both are having dyspnea. Okay, but COPD is not an infectious disease. This is mainly due to the it's decreasing the lung compliance. But pneumonia is mainly caused by the bacteria. Okay, streptococcus pneumonia is the causative organism. So in pneumonia, what happened? In pneumonia, the client, the both in COPD and pneumonia patient have the common symptom. What common symptom? Just to identify it. Okay, common symptom means what? Dyspnea may be the common symptom. Okay, but can you please tell me about some specific symptom which are related with the COPD? Tell you one, you can think and you can tell me one symptom which are particularly relate to the pneumonia as comparing with the COPD, because it's an
uh,
infectious disease.
Infection, fever, ma'am.
Fever, because there is a presence of the pathogenic organism.
What are
So
the
we can identify the specific symptom. I'm just make you to clarify what are the common symptom and what are the specific symptoms. So we need to identify when we read the disease conditions. First, we need to identify the basic anatomy and physiology. Okay. Second, we need to identify what are the changes, physiological changes which are happening in the body when a person is affecting with the particular diseases, and what are the pathophysiological changes we need to know about it, and related to the pathophysiological changes, what are the signs and symptoms which are manifested by the client. Okay. Then we
yeah.
can look about the diagnostic evaluations, management. In management, medical, surgical, nursing, nutritional management, then health education. That areas are covered by the nursing management. Okay. So hope you got a clarity on physiological adaptation. So the main topic, the topic I will tell later. Okay. And the second main criteria, the second main criteria is safe and effective care environment. Okay, safe and effective care environment. See, in first criteria, physiological integrity, in that basic care and comfort, pharmacology, reduction of risk potential, physiological adaptation. Second criteria is the safe and effective care environment. We know that the NCLEX RN questions are mainly focusing to promote the safety of the patient. Okay, promote the safety. That means, for example, it's a management related question. We need to identify whether the management or actions which are giving to the patient is promoting the safety of the client or which are affecting the safety of the client. Okay, and what are the management or what are the options which are promoting the safety, we can choose that. Okay, and how we can identify by correlating with each option. Okay, and for example, if the questions can be asked the most priority need of the client or most priority care which are needed by the, like that, how we can, by reading the option itself, we can identify the most concerning problem. So according to the priority of the problem, we can identify the priority of the care. Which method we can use that priority of the problem?
Elimination.
Using the elimination method, we can identify. That means we know the ATP method. ATP means assessment, diagnosis, planning, implementation and evaluation. Okay, by doing that, from while reading a case scenario, okay, case scenario can be identified the effective communication tool, what is bar method. Okay, using an SBAR method, we can identify a case scenario, identification of the patient, situation. Situation means current complaint of the patient. B means background. Background means history of the illness. A
Yes,
means the
illness.
assessment findings. Yeah, according to the situation, we can find out what are the changes happen in the patient by doing the assessment. R means recommendation. Recommendation means what are the treatment or responses by the physician to the client. That is the main Whisper is a communication tool. That is the main hand in taking, mostly used in our handover taking. But this method we can apply it in a identification, easy identification of the case scenario. So while identifying the case scenario, after that, by using the method ATP method, because in here we are doing the assessment. So in assessment we will get what we will get, both subjective and objective data we will get it. Okay, subjective means what are the complaint which are tell by the client, and objective means what are the complaints which are observed in the patient. That means we are finding out in the client, the assessment finding, that is the objective data. So after on the basis of the priority of the assessment findings and problem, we can what make nursing diagnosis. That is the diagnosis. For example, uh, by doing the assessment itself, we can identify which system is mostly affected. Okay, so if it is a respiratory system, we can make the nursing diagnosis according to the priority of problem which are observed or which are subjected by the client. So accordingly, we can make the nursing diagnosis. On the basis of the priority of the problem, we can plan the care. That is the planning. Okay, plan the care. Then we can priority of the problem, and whatever the care we have planned, then we can implement in the client. That means we can act in the client. So you have to keep in your mind that whatever the care we are planning and whatever the actions or implementations are we are giving to the client, it should be the mainly on the basis of priority. Okay, prioritization is the important one for the NCLEX RN question. In prioritization, how we can identify it? Prioritization, which method we can use? You know about it already, I have mentioned many times. ABC or Maslow's
Uh,
hierarchy. Yeah, good.
uh,
First we need to apply the Maslow's ABC. That means the airway, breathing, and circulation. If the ABC is intact, we can go with the Maslow's hierarchy. That means the physiological need of the client. Okay. For example, the order of the, for the easy understanding, I can say the first order will be airway. Okay. Airway, how if the airway is obstructed, okay, and if the client is having okay, tracheal deviation, or the client is going in the stage of respiratory arrest, in such cases, airway will be our, in case of foreign body obstruction, in case of aspiration, okay, in such cases airway will be our most priority. And second is the breathing means if the client is having any lung condition or respiratory conditions like COPD, asthma, pneumonia, or pleural effusion, or whatever, and which are affecting the saturation. If the client is having hypoxia, or the client is going in the stage of complication, respiratory failure, in such cases, breathing is the priority. Okay. Third one is the circulation. Circulation. Can you tell me one example for the circulation when the circulation is become priority?
any bleeding.
Yeah, bleeding, burns. Okay. In such
Okay.
cases, circulation will be the priority. Okay, when breathing, mainly the respiratory conditions. Okay, and in circulation, mainly the bleeding, then burns. Okay, this will be common. But burns have some one exception that in case of burns in the upper part of anterior chest and face, okay, in case of
Yes.
yeah, which one will be priority?
Breathing will be the priority.
No, not breathing. Burns in,
I mean, airway.
yeah, airway will be the priority because there may be a risk for airway spasm. Okay,
Yeah.
yeah, face and anterior trunk. Face and, so in your case study, you have to read thoroughly. If it is a burn related question, don't rush to the answer. You have to check the location of the burn and also the, if it is a even if it is the total body surface area is affected, if the percentage will be higher, even don't rush to with the circulation. Okay, you have to check whether this face and anterior trunk is affected with burn. In such situation, airway will be our most concerning priority. Okay, understood? So this is the method we are using. Now you understood about a case study. That means in case of water case study analysis, we can use the method bar tool, and how we can identify it. We can apply the method at P to identify the priority of the problem. So next, how we can prioritize the problem on the basis of ABC, Maslow's hierarchy. Maslow's hierarchy means physiological adaptation, mainly the physiological need. For example, if the client, if the ABC is intact, then the pain will be pain, safety. Okay, these will come under the highest need. That means if the client has no issues with airway, no issues with breathing, no issues with circulation, next, and if the scenario is dealing about the patient has pain, okay, which will be the highest priority? Pain is the highest priority. But when we giving answer to a question related pain, always check the pain scale. Pain scale, what is the use of pain scale? To identify the severity of the pain. Okay, that means whether the client is having mild pain, or the client is having severe pain or moderate pain, and we can give the pain scale 0 to 10. Okay, how much? And we can ask the client, or in the case scenario, they will tell about the patient is complaining with the pain score of 8 or pain score of 5, like that. Okay, and if it is 0 to 4, the patient is having mild pain, And moderate means the client is having 5 to 7. It's a moderate pain, actually not 6. Okay. And if it is a severe pain, means client is complaining with the 7 to 10 is the severity pain. So for example, in mild pain we can manage with the paracetamol tablet. Okay, that means only mild pain will be there. And if it is a moderate pain, we can what injection, IV injections, like analgesic injection. Okay, injection. Tell me one example for the analgesic.
Diclofenac.
Yeah, diclofenac, tramadol. And if it is a severe pain, the client need IV opioid analgesic. Okay, that means the client is having severe pain. Okay, then like morphine.
Morphine center.
Yeah. Understood the difference. Actually, I am telling about to easy understanding about the pain. Here, the privatization we know, and in case of safety, that means there are so many questions are there in get. If it is an aged or if it is a hospitalized client, there is a fall risk. Okay, and it will affect the safety, and also that means child seating, and even interpersonal violence. Such topics are coming under the safety, and also fire safety, triage, everything will come. Okay, so these are the main the hidden strategies we have to identify even any question analysis. Okay, so second criteria is safe and effective care environment. In that, the first one is management of care. Okay, that means how we are managing with the client. And next one is safety and infection control. Okay, third one is psychosocial integrity. Psychosocial integrity means the mental health related, all the topics are coming under the psychosocial integrity. Okay, and the fourth one is health promotion and maintenance. Here all the screening test, all the, that means the what health promotion, and how the health is maintained, that is to preventing some getting some infections or illnesses. Okay, in children growth and development, milestone development, screening test, immunizations, all this coming under the health promotion and maintenance. Okay, these are the main criteria they are assessing in our question analysis. Okay, so in I will tell you about each topic in each criteria. In on the under the basic care and comfort, the main question asking areas from one is related with the pain. Okay, pain physiology, and we know that in case of pain, acute versus chronic conditions, which one will be the highest priority we are giving. If the client is having acute pain, that we need to manage first rather than complaining with the chronic pain. Okay, and also in the questions related to the mobility. For example, the DVT is a complications due to immobility, pressure sore, or bed sore. Okay, bed sore is a immobility complications. And the safe transfer, that means the questions can be asked from the transferring of the client from bed to chair to bed. And if it is a spinal cord injury, how we can, the log rolling type questions, that means while transferring the client from bed to trolley, like that some transfer related questions are coming under the mobility. And also assistive devices, use of assistive, that means use of extra pillows. Okay, then in after the hip replacement therapy, to separate the legs, we are using the abduction pillow. Abduction pillow is a assistive devices. And the patient has breathing difficulty, for the easy breathing we are providing the comfortable position, Fowler's position. So bed rest is the assistive devices. And some clients will lean forward, okay, to make the breathing easy. The over bed table can be provided. Okay, that means these are some assistive devices which are using for the comfort of the client. Okay, and such type of questions are coming under the mobility. Next one is nutrition. In case of nutrition, we know that what normal feeding as well as parenteral feeding, especially nasogastric, jejunectomy, gastrostomy, such feeding, and also the refeeding risk. And the refeeding usually it's occur in case of you have attended the nutrition classes, the bulimia
Yes.
nervosa,
Yes.
anorexia. Okay,
That's yeah.
yeah, such type of questions, and sometimes the questions can ask from each disease condition have some specific diet which are related to the disease. For example, if the client is having renal diseases, uh, renal diet are recommended. Okay, that means the low sodium diet. And in case of cardiac patient, we are providing the cardiac diet. That means what, avoid fried items, avoid salt, and fried items can be limited. Mostly we can include the fruits and vegetables. Okay, and if it is a diabetic patient, anti-diabetic diet. And also if the client is having one more thing, that means those who are taking the warfarin, there is a consistent use of leafy vegetable. So such topics are coming under that is the therapeutic diet. Therapeutic diet means the diet which are specific to particular disease conditions. Okay, so that is the main question asking areas, enteral versus parenteral. Next one question is related from the elimination, that means related to the bowel pattern, constipation. Okay, and urinary retention, catheter care. In such type of questions are coming under the basic care and comfort. So understood about this topics, the criteria, and what are the topics which are coming under each criteria. Okay, Ashini?
Yes, ma'am.
Okay. So next criteria is pharmacological and parental therapy. We know all the pharmacology related. That means the drug related questions. That means the five rights of the drug administration. We know that before administering any drug to the client, we need to get cross checked with. Okay. What are the five rights of medicine administration? Do you remember?
Right, right route, right drug,
So there is a
right.
see, don't memorize it. You just think you are going to administer a tablet, what paracetamol to a patient. Okay, patient has a fever. Suddenly the physician has ordered to give, or you got the PRN order. Okay, how we can identify? First we are looking the right route, or first we need to identify the patient. Okay,
The
right
patient.
patient.
Yeah.
Yeah, right patient, right dose. Then we are
Right,
going with in which route we are. Next,
right
right
drug,
time.
right dose,
What is the
route.
right time of the, and even the patient has the right to refuse the drug. Okay, then
Yes.
right documentation. Okay, so such things should be. And one more thing, how we can verify the right patient, we can verify the hospital. First we can identify with the patient name and date of birth, because there may be multiple patient with same name. Okay, and so how we can confirm with the date of birth. That's very important question, can be confusing in such kind. How we can identify the patient? The patient can be identify the name and the date of birth. Okay, that means we have to ask the client to repeat his name and date of birth. And also we can cross check the ID band with the whatever the client is saying the date of birth, we can check with the ID band. Okay, actually here in most of the bedside there is a system. When we are going to administer the medicines or injections, we can open the system. We can scan the patient's ID band, so the patient's detail will shows, and what are the medications we are going to give. That means the scheduled dose of the medicines are shows on the computer. In scheduled dose, we can check with each medicines. Okay, that means first we need to identify the patient. How we can? Not only by the name and the date of birth. Mostly what we are confirming the name and date of birth the client. If the client is a disoriented client, we can check with the hospital number. Okay, the hospital number will be there. So even sometimes there may be patient with same name and same date of birth. Okay, in such cases we can confirm with the hospital ID number. Okay, then right drug, then right dose, right route, right time, and write documentation. That means whatever the medicines we have administered to the client, it should be documented correctly or properly. Okay. And also some drugs are look like drugs will be there. So when we withdrawing the medicines from the medicine cupboard, we should double check everything. Okay. That means before withdrawing the medicine from the medicine cupboard, we have to check it with properly. Okay. And also before administering to the client also, we have to make it confirm with the order and the medicine. Okay, that means, and actually in here in European countries the errors are very limited, because all the medicines are already showed on the system, and we are scanning the medicine. So when we are scanning the medicine, if it is a overdose, it will shows by the computer, and if it is an underdose also, it will shows by the client. Okay, so it's very easy here, but in our in India, where we worked, we know that. That means here we need to check the patient's chart, or if it is a computer, the computer, whatever it is, then we have to take the medicine. We have to check with the dose whether it is a higher dose. That means we need to put extra effort. But here also we should be very conscious. But here the risk is too less when we administer medications properly. Just we have to go through the criteria, then we can administer the medications. The errors we can get limited. Okay. And also we should know about each medicine and what's the medicine use. For example, if it is an antibiotic, what is the use of antibiotic?
It's prevent the infection.
Infection. That means like that each medicine have some specific actions. So we need to identify the action and metabolism and half-life of the drug also. For example, half-life means how long the drug will be available in our body. For example, you are administering a rapid-acting insulin. Okay. You know about how long the insulin will be present in our body, and when will be the peak of action, and after the half-life has ended, what happened, the blood sugar will get started to decline, hypoglycemia can occur. Okay, that means the half-life of the drug we need to get identified. Okay, for example, if it is a 3 times in a day, if the client is getting a drug, we should not postpone the each dose. That means if the client is having a drug 3 times in a day, morning, afternoon, evening, that means when we administer drug in the morning, that drug will have the half-life until the afternoon only. After that, there is no effect for the drug, so we have to administer the next dose. Okay, and one more thing, if a patient has missed any dose, what will you do? If the client has not taken the drug on time, otherwise the nurse has not administered the drug on the time because it was a busy schedule, what will you do next?
Means what drug we will just first identify. If it is insulin and all, so again we will check the sugar and then we will give.
Oh, that means we need to check the time. Okay, if it is a near to the dose, for example, if it is a 15 to 30 minute, okay, in such cases we can administer the drug, but we should not administer if the time has exceeded from the prescribed time. If we are doing so, and if we are giving the first missed dose, and then again we are going to give the second dose, so it will cause toxicity of the drug. So always check the time, the missed time, what are the time duration. So if it is a long time, we should not administer. What we can do, we can skip the first dose, then we can go with the second dose. Okay. And one more thing, as you said, if it is an insulin, of course we can check the blood sugar, and if the blood sugar is low or blood sugar is high, we can manage accordingly. Okay, that means be careful enough that if it is an insulin, the food should be ready. Otherwise, what happen? The client will go into hypoglycemia. Okay, so that are it's common things we have to keep in mind. And also we know each system has some specific drugs. That means cardiology drugs, respiratory drugs. For example, if it is a respiratory condition, bronchospasm, bronchodilator. And in case of asthma, there can be acute relief bronchodilator will be there. Okay. And if it is a COPD means what? There also bronchodilator will be there along with the NSAID will be there. Steroid inhaler will be there. Prolonged use. Okay, like that we have to. That means albuterol, salmeterol. Albuterol is a short-acting beta agonist. Salmeterol is a long-acting. Yeah, salmeterol mostly we are for a long-term use only we are prescribing to the client. And also this albuterol will provide the acute relief from the. So for example, if the client is developing sudden dyspnea because of some if it is an asthmatic patient and if the patient has exposing with any triggering factor, for example polluted area, the client will get what breathing difficulty. So in such cases, for getting an immediate relief from that bronchospasm, acute beta agonist is the drug. That means the puff will be the puff can be used. That means the puff will provide a immediate relief from that severe bronchospasm. Okay, that we will learn in detail with the each system. And also endocrine, the hormones, okay, and the insulin, like that, glucagon, that will come under the endocrine. And neurological medicines, psychiatric medicines. For example, neuro conditions are entirely different with the psychiatric conditions. So the drug of action will be different. Don't think that psychiatric and neurotic drugs are same. No. Neurological drugs are for the neurological conditions. For example, stroke patient, okay, myasthenia gravis patient, multiple myeloma patient. Such conditions are neurological conditions and it should be managed with the neurological medicine. And the schizophrenia, depression, bipolar, that are the conditions which are coming under the psychiatric conditions. So there may be some psychiatric drugs which are for the, that means antidepressants, the anti-anxiety drugs, anti-manic drugs like lithium, that are coming under the psychiatric drug. That means we need to identify the major classes which are having each disease, not each system. Okay. Next, IV therapy. IV therapy mainly the solutions, isotonic solution, hypotonic, hypertonic. Then the infusion method, that means IV, the mainly the complications of IV therapy, and the peripheral line, central line, PICC line. PICC line means peripherally inserted central line. Okay, mainly the complications, infections, and infiltration, extravasation. Such topics are coming under the IV therapy, and this topics are based on the pharmacological and parenteral therapy. Okay. Next one is reduction of risk potential. Reduction of risk potential means the reduction of complications. Okay. Complications means how we can identify a client is going in the stage of complication by monitoring the ABG, complete blood count, the specific marker, cardiac markers, okay, and some monitoring devices like telemetry. Telemetry means we are monitoring the ECG of the client. By actually here it is saying about we will apply the ECG leads on the patient chest and it will connect it to a telemeter. One device will there. The device will we will keep at the pocket of the patient, and this will already connecting each the telemetry device is connecting with the central that system. Okay, central system. So what are the patient's ECG we can monitor even by sitting in our nurse's station. That is the telemetry. We are in this telemetry is common here, but I don't know it's common in India or neither. I don't know about it. Yeah. Otherwise, we mostly ICU. We have the cardiac monitors. Okay, ICU settings. We are connecting the ECG leads, and at the bedside there will be monitor. So on the monitor we can identify the patient's ECG, patient's heart rate, saturation, everything we can monitor on the cardiac monitor. Okay. And also in case of the increased ICP, even if the client is having electroencephalogram, okay, that can be monitored at the bedside, so we can monitor the electrical activity which happening in our brain, okay. And one more thing is a Holter monitoring. Holter monitoring, same like it will attach, the leads are attaching with the client's chest. Then one Holter is the one device that will keep at the patient always. That means if it is a 24 hours, we need to identify the ECG changes. For example, in case of heart block, or if the client is having palpitation, so we need to diagnose it. What is the main reason? So in such case, client, for identify the changes, we can use the Holter monitoring, okay. That mostly for the Holter monitoring used on the OPD basis. That means after wearing the Holter, the client can come on the OPD and we can apply the Holter. The client can go home and can do the normal activity. So on the after 24 hours, the client can come and we can remove the Holter, and we will get the ECG changes which have happened during the whole 24 hours. So we can monitor the ECG changes, okay. What in when that means mostly when the client is doing any activity, what is the ECG changes. When the client is doing any rest, what is the ECG change. Like that we can correlate the conditions, okay. So these are the monitoring devices. Next one, complication recognition, means identify the complications. For example, early signs and late signs, for example. And if a client with the COPD, okay, COPD patient, how we can identify the client is going in the stage of worsening condition? Do you know about it?
Sorry, ma'am.
If a COPD patient, okay, COPD is a chronic condition, but
Yeah.
patient has brought, you are getting a question, okay, you are getting a question that one COPD patient brought to the emergency department with the severe dyspnea, and the patient's oxygen saturation is 86 patient, so oxygen has started, and suddenly they will give some changes in the patient condition. So by reading the what the nursing findings, okay, assessment finding, you committed to identify that the client is going into stage of respiratory failure. How we can identify it? Can you tell me one symptom
Any
which?
changes in the vital, sudden changes in the vital signs,
Yes,
like
of course, sudden changes in the vital. But what is the assessment we can, when we notice in the, by seeing the patient itself, we can identify the client is going into stage of respiratory failure. How?
moving accessory muscles.
Yeah. Use of accessory muscles, nasal flaring. These are shows when the client is going into a respiratory failure. Mainly, and if the scenario is saying that the client is using the accessory muscles for respiration, use of accessory muscles, that means the client, even in children there may be the work of breathing will be higher, okay, in adults as well as pediatric, both they mostly their respiration is no, it is a effortless one, okay. That means it's an involuntary process. But in when the client is having any respiratory conditions, this breathing will become active. That means the client need to put extra effort for the breathing because of the increased work of lung, okay. And if the client is going into stage of respiratory failure, that means suddenly the dyspnea can be worsened. The client will use the accessory muscles for the respiration, and there may be sudden drop of the saturation, okay. That means the client will go into a stage of hypoxia, because the in COPD mainly the retention of carbon dioxide, the anterior posterior diameter and the transverse diameter, the barrel chest, that means the both diameter will become equal, so there is a hyperinflated lung. So hyperinflated lung means there is a severe retention of the carbon dioxide. So in such cases there may be the chances of respiratory failure, okay. So how we can identify the complication in early stage? When there is a saturation fall, sudden deteriorating vital signs, and if the client is using the accessory muscles, that is the late sign, and which indicating what the client is going into stage of worsening situations, okay. This is the areas we are focusing on the reduction of risk potential. Next one is physiological adaptation. Physiological adaptation, I already said, each system is affected, and when it is when our body is affected with any of the disease condition, our body will trying to compensate with each conditions. Okay, for example, if there is a we know the compensatory mechanism of ABG, that means if it is a respiratory acidosis, the body will compensate with the metabolic alkalosis sometimes. Okay, and if it is a metabolic acidosis, there may be some respiratory alkalosis with the compensatory mechanism can happen. Okay, that means opposite, we compensation means we are tallying with the opposite one. Okay, in case of hypovolemia, what means that means if the client is having severe bleeding, okay, and it can turn to hypovolemia. And when the hypovolemia is occur, what can be the main vital signs changes? There may be decreased cardiac output. Okay, decreased cardiac output. So what will affect the BP?
Hypotension.
Yeah, there may be low BP. So how the body is compensating with it, the heart will contract more. Okay, yeah, that means heart rate will increase. The compensatory mechanism is the, so that only in case of shock, there is maybe there is a low blood pressure or hypertension, the heart rate will be higher. That is the compensatory mechanism. That means cardiac output means what? How much amount of blood is pumped out by the heart. Okay, so how we can if the force of contraction is less, that means in case of heart failure, you just imagine heart is not able to pump adequate blood. Okay, so heart will try to contract more, that means to supply more blood. So the heart rate will be higher. Okay, that is the one adaptive compensatory mechanism which are exerted by our body itself. And also the main topic question asking areas are hypovolemia, septic shock, cardiogenic shock. Okay, septic means the shock which are related to any septic conditions. Cardiogenic shock means the shock which are caused because of any cardiology conditions like heart failure, the pericardial effusion. Okay, like that. And the next topic, fluid and electrolyte. We know the major electrolytes: sodium, potassium, calcium, magnesium, phosphorus. Okay, and we need to know about the abnormal. If the normal electrolytes are not present in our body, it will affect our body functions. We know that sodium has a major role in our absorption of the water also, because sodium and water both are moving in the same direction. In case of hypovolemia, for example, in case of hypovolemia, not hypovolemia, I will tell you about the polyuria. Okay, polyuria means what? There is excessive loss of the water. Okay, so when there is excessive loss of the water through the urine, there may be the loss of the sodium also. Understood? That means the sodium and water is moving in the same direction. And one more thing, the sodium has a main role in our blood vessels. Okay, that means the sodium can cause the increasing of the peripheral vascular resistance, and it can lead to what? Hypertension. So that only in case of hypertension, we are recommending the sodium restricted diet. Understood? Because sodium can increase the blood pressure. Okay, sodium can increase the BP. So in case of hypertension, we are recommending which diet? Sodium restricted diet. Okay. So next, potassium. Potassium also have a role in our heart contraction. That means both hyperkalemia and hypokalemia will cause arrhythmia. Arrhythmia is a life-threatening complication. Calcium also. The calcium also have a role in our this blood clotting. Okay. So and also the calcium has a role in our maintenance of the thyroid hormone also. So it should be very important. Magnesium, same, like magnesium has a role in our the contraction of the heart as well as the reflexes. Okay, so that, for example, magnesium sulfate in case of preeclampsia, Magnesium sulfate is the management. So before administration of the magnesium administration, we need to check the reflexes. Okay, deep tendon reflexes we need to check. We need to check the respiration, because magnesium sulfate can cause respiratory depression. Also, it can cause decrease the urine output. So the patient who is getting magnesium sulfate, before the administration of each dose, we need to check the deep tendon reflexes, we need to check the respiration, we need to check the urinary output. So these are the some common. Okay, and also potassium. Those who are getting the loop diuretic, there may be risk for what side effect, hypokalemia. In case of potassium sparing diuretic, there may be the side effect, hyperkalemia. So such things, what are the normal findings of the electrolytes, and what are the abnormal findings of any imbalance with this fluid and electrolytes? It should be very question asking areas. And acid base, I already said the ABG. Okay, acidosis, alkalosis. And next we need to using the method. Which method you can use to identify the ABG? Raw method. Raw method means respiratory opposite metabolic equal. That means the pH and the bicarbonate will move in the same direction, but the PaCO2, that means partial pressure of the carbon dioxide, is just opposite to the pH and bicarbonate. Okay, so and first how we can read the ABG means, first we need to identify the pH. So if it is less than 7.35, it is acidosis. If it is greater than 7.45, that is alkalosis. Next, our duty is to identify whether it is a metabolic or a respiratory. How we can identify? By checking the partial pressure of the carbon dioxide and the bicarbonate. If the bicarbonate is deranged, it is metabolic cause, and if the carbon dioxide is affected, the respiratory cause. Okay, then we can rule out whether it is a respiratory acidosis or respiratory alkalosis, or metabolic acidosis or metabolic alkalosis. And next we can check the compensation also. We know that when there is any deranged or any defect in our normal the value, the compensatory mechanism will get activated. So we can check it. If it's a respiratory condition, always there is a compensatory mechanism with the metabolic one. Okay, so like that, by practicing some questions, we can easily identify which mechanism. And compensation also three types: fully compensated, uncompensated, and partially compensated. How we can identify means by checking the value of the pH. If the pH comes into normal, that is fully compensated, and in partially compensated and uncompensated, pH will be abnormal, but we can check it which the parameter has used for the compensation. Like that we can make it, identify it. Okay. And next topic is organ failure. Organ failure means mainly we know when there is a decreased perfusion. The perfusion firstly affecting our brain tissue, okay, then kidney, then even the peripheral system, the liver, kidney. How we can identify if it is the renal system is going into stage of failure? By checking the urine output. That means if there is no production of urine or decreased production of the urine, that may be renal failure. And the liver enzymes are elevated, the bilirubin is elevated, and the ammonia is accumulated. In such cases, we can identify the hepatic failure. We know that the hepatic encephalopathy is a very important topic. How we can identify? The ammonia will get accumulated in our body. So the ammonia need to get eliminated through the body through feces. Okay. Otherwise, what happen means this ammonia can easily cross the blood-brain barrier and it will affect the brain tissue. So it can lead to hepatic encephalopathy. So in case of hepatic encephalopathy, the main treatment of choice is, do you know which one? Hepatic encephalopathy.
Thiamine.
No. Because you think there is ammonia is accumulated. Okay, excess ammonia. Yeah, so the ammonia need to eliminate it through the feces only. Okay, so what can be? Which one?
Lactulose, ma'am.
Yeah, lactulose is the treatment, the choice for the hepatic encephalopathy. Otherwise, that means how we can identify. Sometimes they will give some, they will start the case study with the liver failure or liver cirrhosis. Liver cirrhosis. There the question can be entered with the hepatic encephalopathy management. Okay, that means we need to identify. Sometimes the client has developed sudden confusion or restless, like that it is and the disorientation. That means if the client is showing the symptoms of neurological symptom, that is mainly due to the hepatic encephalopathy. Okay, so the treatment of choice is what? Lactulose, that is to promote the stool elimination. So ammonia can be eliminated through the stool. Okay, identify. So that means we should get a clarity. For the NCLEX, the reading theory, doing thousands of questions, that's good. But if we don't have a clarity, okay, if we don't have a clarity on what the topic is, question is asking about, what is the main problem of the client, what is the priority problem, what is the priority need, or how the planned actions can implement in the client. So if we have a clarity on that, we can easily identify each question, and we can, using the strategy, we can go into a what correct answer. Understood? That means even Ashwini, I have read so many topics here. By reading
Yeah.
each topic, so many things already came into your mind. Is it? When I talk
Yes.
about COPD, when I talk about pneumonia, when I talk about respiratory failure, liver cirrhosis, hepatic encephalopathy, that means we know the theory. Some theory we know, but what we have to do means clearly understand the theory, and that theory need to apply it in the question analysis. For a NCLEX conquering, we need the 30% theory. Okay, 30% theory. Sorry, dear. 30% theory and 70% question practices. How the question practice? Using the quality method. Quality method means the clear understanding of the theory. Okay, the 30% means clear understanding of the theory. Okay, second, the quality question analysis, Nugent question analysis means use of strategy. Strategy means each question we need to identify it, which method we need to apply. For example, if it is a acute versus chronic or stable versus unstable, okay, in then we by reading the option itself, we should wise enough to identify the what particular need which are asking in the question. Okay, that the question we need to identify clearly. Then by marking the keyword in the question, we can identify which what is the question is asking from our side. Okay, sometimes what happen means by reading the question we may find it is very easy question, but we don't even read the question and understand it clearly. So what happened, we will choose the wrong answer because the question was asked. Sometimes the question can be the negative questions, that means the negative answer will be the correct answer, negative statement will be the correct answer for the question. So most of when we are preparing, we won't focus on the question, we focus on the scenario, we focus on the options. The questions we should read twice, understand clearly, then we will get a, after reading the question we can go into the scenario once, then we can locate the keyword, and like IELTS same, like only here we can use it. So we can clearly understand the scenario, so automatically it will by using the elimination method we will reach to the correct option. Okay, and also we should develop a positive mindset. That means we know it is a life-changing exam, so here we need to apply extra effort. So we know we are working, we have the family, everything, but this exam has its own importance. Don't think that by on the side we can crack this exam. No, this exam is not easy, but we can make it easy. How? By learning the theory properly, by consistently if we are practicing the questions, using the strategy. If we are daily, I am not recommending to do so much questions, okay, in a day. Even if you are doing a 50 question a day, that should be very thoroughly. Thoroughly means qualitatively. You have to review the answers, right to answers and the wrong answers. You need to identify why the options became wrong, why the options became right. Sometimes, if we are just a right answer, the rationale may not be the same with our thinking. So we need to correlate with it. Okay. I understood these topics in case of physiological adaptation. Okay.
Yes, yes,
Yeah.
ma'am.
Okay. Next one, the safe and effective care. In that, the topic, other topic is easy only. Okay. That means the delegation. We know what are the responsibility of the RN, what are the responsibility of the licensed practice nurse, what are the responsibility of the unlicensed assisted personnel. That is the delegation. We should very thorough about assessment, health education, admission, discharge, IV injection that are only limited to the RN only. Okay. Oral medications can be given and some injections like IM injections, subcutaneous can be given to the LPN. But the UAP cannot administer medication, they can only give the basic care. That means the basic care and comfort, as well as the what catheter care, such then the what the turning of the patient, that means the position change, basic care can be done by the UAP. But we have to keep in our mind, if the client, for example, ambulation can be the role of a UAP, but if a client is firstly ambulating after the surgery, who is the responsible one after the surgery? Okay.
After the RN.
RN, yeah. And if it is a normal delivery, okay, the pad we need to check it. Who is the responsibility? The immediate post delivery period, who will check the pad of that means how much bleeding. Such thing, who is going to who is the duty?
LPN also can check, RN also can check.
Okay, but mostly if it is a bleeding, if the client is saying that the client is frequently changing the pad and all, it should be checked by the RN. That means we need to verify the assessment. That means if any complicatory stage is suspected, in such scenario, not LPN. Not LPN is not that much qualified to identify the complications. They can do the routine. Okay, routine. Even if it is we are checking the LPN to do the vital signs, or a UAP can check the vital signs, that is only for the stable patients. Okay, but if it is the client is go any sudden complication, okay, and if the client condition is worsening, that means the vital signs is deranged. In such case, only the RN can check the assessment or vital signs. Okay, and also one more thing. mm, and the bleeding also. Okay, that means mostly the urine output can be monitored by the LPN and UAP, and also the drain also can be monitored. But if it is in the immediate post-operative period, we need to identify the bleeding. Okay, that means if the bleeding is not identified early, there may be hypovolemia, and hypovolemic shock can occur. So in such cases, RN is the one who is monitoring the urine, the monitoring the drainage, everything. Okay, that you have to keep in your mind. Always check. Assessment means not only routine assessment, the assessment to find out any complication. That means early identification of the complication also, it should be the duty of the RN. Okay, and about the informed consent, RN is not has the right to take the consent from the client. We can witness it, but we cannot take the signature from the client. And also about the health education, or about the for example, consent is mainly for some procedure, surgery, anything. So such explanation should not be given by the RN. That can be done by the physician or those who are doing the procedure. Okay, so but before shifting the patient to operation theater, we can make sure whether the consent has signed or the client got an adequate information about the procedure. For example, if you are getting a question that the client is asking doubt about why I am shifting to the operation theater, like that, if the client is having a confusion, what will you do? Will you shift the patient to the OT?
No, we
No.
have to inform to
Yeah,
surgeon and
we
then
will hold this. We will make a call to that physician or the those who are done by the taken the sign from the client, so they have to give proper explanation, and then only we can, after confirming the clarity of the information by the client, then only we can shift the client to the operation theatre. Okay. And also prioritization, I already said ABC, Maslow, safety, acute versus chronic. Okay. Ethical and legal, we know there's informed consent, confidentiality mainly, if the client is conscious, okay, and if the client has the right to take the decision on the patient itself, and if the patient is not conscious or unconscious, or the patient, we need to check it whether any advanced directives will be there. Okay. And that means the advanced directive has the right to take the decision. That means the patient has already entrusted that advanced directive, not the family members. Okay. That means if, for example, if it is a DNR patient, that means do not resuscitate patient, the client has already signed for the DNR, but the family members wants to save the life of the client. What will we can do? Can we cancel the DNR which are requested by the patient? No, we cannot do that. In such scenario, the patient decision has the ultimate priority. Okay. And confidentiality means we need to keep the HIPAA. HIPAA means the patient's record should be very confidential. Unnecessarily, we can't disclose the hospital record to the any of the unauthorized person. Okay. And also negligence. For example, if the client need 2 hourly back care, and if the nurse is not doing it, that's coming under the negligence. Okay. That means the proper care should get by the hospital and from the nurse. And also if the nurse is not administering antibiotic, the question can be, we will get, okay, so that I'm saying the answer. If the patient has got an order for the antibiotic at 8 o'clock, but if the nurse is administering the antibiotic at 10 o'clock, is it a good one? No, that's a negligence only. That means here that means whatever the actions which are affecting the patient care, that will come under the negligence. Okay. And also some interdisciplinary collaboration, that means it's a teamwork. That means the healthcare is a collaborative care with it's a team care. For example, not only nurses, the physicians, the LPN, UAP, X-ray technician, ECG technician, occupational therapy, physiotherapist, okay, like that. So many team members will be there in the patient care, that must be collaboratively cooperated. Okay. And next one, safety and infection control, mainly isolation precautions, sterile technique. Infection prevention, mainly the central line associated infection and the catheter associated urinary tract infection. Then ventilator associated pneumonia prevention. Okay. And emergency response, like fire. In case of fire, how we can manage. In case of disaster like earthquake, okay, how we can manage. Triage means we are segregating the patients. If it is a disaster, we need to segregate the client, which client need immediate attention, which the client can be, the treatment can get delayed, like that. Next one is the psychosocial. In psychosocial, we know therapeutic communication. When we talk with the client, we should be very we should be a good listener, and we should not ask a question with the closed-ended question. That means yes or no questions cannot be used. Okay, yes or no means in the question itself there is a question and answer. It's not indicated in a therapeutic communication. Only the open-ended question means we can ask the question, the answer should be get from the client. Okay, that is the open-ended question. And also we should show the empathy, and even client is saying about any feelings, we should respect that. We should not judge the client, non-judgmental. Okay, for example, if the client is saying about any hallucination, we should not argue with the client that you are telling the lie, or you are saying about the wrong things. No, we should respect what the client is saying, but we can make them understand about the situation, but we should not make an argument with the client. Okay. And main mental health disorder which can be question asking area: depression, bipolar, schizophrenia, mania. Okay, sometimes the personality disorders can also, we will get the questions. Then crisis intervention, grief, stress, coping. These mental health related topics are coming under the psychosocial integrity. And all the growth milestone development or growth and development, and screening test, immunization, and aging versus, that means some changes are normal in our newborn period, and it can be the abnormal when we came into adult stage. Okay, and also some changes, for example in newborns, after 3 days if there is a elevated bilirubin, that can be a normal what jaundice, that is a physiological jaundice. But if the child is born with the jaundice, that is a pathological. Okay, like that we have to identify what are the normal changes, what are the abnormal findings. Okay, and the cardiovascular system, each system has some what important topics which I have already we have discussed earlier. Okay, so these are the main topics which coming under the criteria of the NCSBN. So we should thorough about, if we are thorough about with each topic, with each criteria, so we can, the question analysis will be easier for us. Okay, so the strategy we can mainly use what the ABC, safety, that means always promote the safety of the client. Okay, and the elimination method for the option elimination. Okay, priority framework we can apply. Why this, the main strategy we can apply priority framework, then using the elimination method. Okay, and positive versus negative burden, that I have already said previously that sometimes the negative sentence will be the correct answer, so we should identify and read the question clearly. And the expected versus unexpected finding, some options they will give some finding that can be the expected finding. For example, an appendicitis patient is complaining about a pain 8 out of 10, that may be the expected finding. But if the client is saying that he got a sudden relief from the severe pain, is it an expected finding? No, that is an
Not yet.
unexpected finding. Why? Because there may be the chances for rupture of the
Correct.
appendix. Okay, so we need to correlate what is the normal finding, what is the abnormal finding. Then in select all that type, there is a risk for losing of the marks, so we should very thorough about. Sometimes in the bracket they will ask about choose any 2, choose any 4, like that. So we should choose that limited only, not more than that. If we are choosing in the wrong answers, there is a chance for losing of 4 marks. Okay, so these are the main criteria and strategies we have to apply it in our question analysis. I will send some questions so you can practice that question, that you can do the questions. Okay, and send me the score. I will after that I will send the answers also. So these things you have to keep in your mind, what are the criteria and what are the strategy we have to apply. So that is for our making the theory understand. Okay, I will send some questions. Any doubt on any of this topic, Ashwini? So today itself you have to be very serious. Okay, that means you have to spend at least 1 hour for your personal question analysis. Whatever the duty time, that's okay. But if you are not able to spend 1 hour, at least half an hour you spend some time for your personal question analysis, not the class, the personal question analysis. That is to that automatically we can boost up our critical thinking. That's it. Okay, Ashwini, any doubt?
Yes. No, ma'am.
Okay.
Yeah.
Yeah. Okay, there, 1 second. So